Hello everyone, it's Dr. Poornima Srinivas again from Hills Dental Design. I'm the founder and owner of Hills Dental Design, where healthy and beautiful smiles begin. Today, what I'm going to talk about is basically a single tooth implant. So, the contraindications or the indications where we can actually put an implant, and we'll just go through it step by step. Now, when you say implant, why do people are looking for an implant? People are looking for an implant where they have a missing tooth. So the missing tooth can be anywhere in the mouth, the front of the mouth, or on the side of the mouth. And I'm also going to go through later on in the post as to different areas of the mouth, what you need to look for as well. But today, let's assume you've got a missing space and you're wondering what to do with it. So remember, with the missing space, the options we have is a bridge, an implant, or a denture. So we are just going to be talking about implant. So what's the good thing about implant and what is an implant? Implant is a fixed prosthesis replacing a missing tooth, where the titanium post mimics the root of the tooth, and then you've got the crown which mimics the crown of the tooth. So that's as simple as that. So it actually mimics your own tooth. So let's look at the implant here. Now we did talk about that. So that is the implant, where is you've got the post and then that's a crown there. So and is that done at one stage or the second stage? Now there's a lot of post I'm going to be going through with different things, but today we're just going to focus on a single tooth replacement, which is implant. So who can have it? So a lot of people get excited about implants because they're like, wow, this is a fixed option, let me look at what I can do. So the only problem with that is when patients come in, they need to understand their mouth, they need to understand how good their oral hygiene is. And I'm not going to treat a patient who has never been to the dentist for a long time, whose oral hygiene is not that good, so it's not up to scratch. So you've got calculus everywhere, it's bleeding, it's infection, and they just come to me and say, well, I need an implant, I've lost a tooth. Now they need to understand why they have lost a tooth and what is the reason. So that way we just want to make sure that they understand, because the implant can also be affected as well. So one of the contraindication, which is a local contraindication, is if a patient has a periodontal disease. A periodontal disease is a jawbone disease. So basically we have the infection in the gum, and it's also there's an infection in the bone as well, and the patient hasn't been to regular visits to the dentist. They also are not aware that they have this periodontal disease or acute gingivitis or severe gingivitis. Then we don't say, well, let's just put an implant in. We can put an implant in if the patient does show that they can actually take care of it, the inflammation has subsided and everything's under control. So that is the local factor. The systemic factor. So when you come in, obviously we go through all the medical history and to understand whether you are eligible for an implant. Now there are some things, some medical conditions where we say, no, I think we should just not do it. Say, for example, if the patient has some jawbone disease or they've got cancer, they've had radiotherapy, a lot of radiotherapy in the head and mouth region, they have immunocompromised, they've got autoimmune disease. These are the major contraindications. So even hormones as well. So if, for example, when I talk about hormones, is diabetes. If the diabetes is not under control, then it's no good putting an implant in. Why? Because the failure rate is very high. If you've had a recent heart problem, or you've had, myocardial infarction, or you've got prosthetic replacement of the heart valve, then yes, we say no, we do not want to do the implant, because we just don't want to put another foreign body in your mouth. So these are the contraindications. Now the other thing simply can be your age factor. So some patients come in and they are not 21 yet and they have a missing tooth. Now The reason for that is the bone hasn't, taken its final position. The gum hasn't taken its final position. So we just need to make sure that we wait for the bone maturity, which is normally around 21, to put an implant in. And also for a younger patient, we look at, can we move this orthodontically? So we can actually, if there's a one tooth which is missing, then we can just make sure that we just group it together or move it through orthodontics or braces. So that is why we say no if a patient is under 21. And the other thing as well, from an age spectrum, that we don't want patients who are really old to have implants. Now, what is really old these days is that we are saying 90 plus, 85 plus, and it also depends on their medical condition. Now, I do have a lot of older clients, and some people are really good, their health is fantastic, and they've been really good coming to the dentist, and we sort of consider whether giving them an implant if they do ask for one, or if there's a need for one, if they will benefit from it. If they do, yes, we do go ahead. But as you age, obviously your systemic conditions, you will have some issues or the other. You also end up having a lot of medications, or you might be restricted, and that's just the systemic part. But the local part might also be decrease in saliva, the patient, the dexterity, they can't keep their area clean. But normally those people don't really go for implant as well, and we don't suggest that, because they have all these issues. They need to sort of look at and if they have all those problems, they will not look at implant. Now, interestingly, some people are gaggers, so some people gag a lot. So when I say gag, what does that mean? That means that they can't have any prosthesis in their mouth, so implant would be a suitable option as well. But let's look at bone. What the problem happens with the bone, or for an older client, is that the older client, it becomes sclerotic, which means it becomes very hard. It's like drilling through concrete. And we love the age group. It has to be between 21 and say 80. That would be a really good age group, because we know we can work with it. But again, we need to look at customizing and personalizing the treatment plan. So what did we learn today? We learned what is an implant, a single tooth implant. So basically an implant it replaces a missing tooth, and it's got a titanium pulse which mimics the root of the tooth, and then you've got the crown which mimics the crown of the tooth. Okay, we talked about indications and contraindications as well, where we can place an implant, and what are the contraindications, which is the systemic factors, which means that they have to what their health looks like, and also the local factors. So the local factors also play a very important role, and we want to make sure the oral hygiene or the foundation is really good before we commence any treatment, or even we recommend any treatment for you. So that's about it, folks. Thank you for listening. Please share and like or comment on the post. This is it's been 4 weeks now since I've been doing this Facebook Live, and it would be really good if you can encourage me by liking and sharing it. And if you do need an appointment, or if you think that you are considering implant and you want to know more, please feel free to contact the practice on 94841913, or you can email us at info@hillsdentaldesign.com.au. Again, this is Dr. Poornima Srinivas from Hills Dental Design, where healthy and beautiful smiles begin. Thank you.